The TRuE-Registry is a registry investigating the prognosis and risk profile of patients with severe tricuspid regurgitation. Severe tricuspid regurgitation is a heart condition that is associated with generally a poor prognosis, but we know that these patients are a group that can be further stratified into patients with a more favorable versus intermediate or high risk of long-term mortality. And it was the purpose of this registry and the analysis to identify subgroups of patients with low versus high risk of mortality. The data was collected in a retrospective fashion. That means first we identified patients in our databases that were admitted to the hospital with this type of diagnosis. And then we analyzed the available imaging studies of these patients. They were investigated or reanalyzed by blinded investigators according to standardized protocols. We investigated the right ventricular remodeling based on the initial echocardiogram, and when we had these data, we secondly acquired the data regarding the long-term prognosis and mortality in these patients. So the main finding is that patients with severe tricuspid regurgitation are not a homogeneous patient population. There are patients that have a more favorable prognosis or lower long-term mortality versus subgroups of patients that have a higher or even excessive long-term mortality. So this information is very useful when you want to decide which patients you treat with interventional versus conservative treatment.